My name is Dr. Chio Yokose, and I'm a rheumatologist and researcher at Mass General. Today I will be speaking to you about gout. Gout is a very common type of arthritis caused by uric acid crystals. For the majority of patients, gout symptoms are usually episodic, meaning they experience very painful flares of joint pain in one or a few joints, followed by periods without any joint pain in between. We all have measurable amounts of uric acid in the bloodstream. However, some patients can have elevated uric acid concentrations in a condition called hyperuricemia. There are several factors that contribute to hyperuricemia, such as age, sex, genetic predisposition, other medical problems such as kidney disease or metabolic syndrome, diet, and certain medications. When the uric acid concentration is chronically elevated past its saturation point, it can precipitate out and form crystals, which then deposit in the joints. These crystals can then trigger a strong inflammatory response, which results in painful gout flares. We employ a two-pronged approach to treating gout. One is the acute treatment of gout flares with anti-inflammatory medications, and the other is long-term gout management with urate-lowering therapy. Acute gout flares are treated with anti-inflammatory medications to relieve the excruciating pain. Commonly used medications include colchicine, nonsteroidal anti-inflammatory drugs such as ibuprofen or naproxen, and steroids. They're all very effective, but there are different risks and benefits to each, so please discuss with your doctor what would be the optimal medication for you. One tip to keep in mind is that all of these medications are most effective when taken at the first sign of a gout flare. In fact, if you take an anti-inflammatory medication at the first sign of symptoms, you may be able to abort the flare. These anti-inflammatory medications are generally only taken when you're experiencing a gout flare and can be stopped once the symptoms resolve. For the majority of gout patients who have infrequent gout flares that are readily treated with these medications, no other treatment is required. However, a small fraction of patients with frequent gout flares or other medical problems such as kidney disease may benefit from a more long-term management approach. This involves taking a medication to sufficiently lower the uric acid in the bloodstream such that it prevents the development of new crystals and allow the existing crystals to melt away over time. The most commonly prescribed medication for this purpose is called allopurinol. This medicine is taken every day regardless of symptoms, similar to the way you might take a daily pill for your blood pressure or cholesterol. Medications like allopurinol are very effective in eliminating gout flares in the long term. However, unfortunately, it can be associated with a transiently increased risk of gout flares in the first several months of therapy. For this reason, patients are recommended to also take one of the anti-inflammatory agents I mentioned previously every day when starting allopurinol, in an effort to prevent gout flares in the first place. Once the uric acid is sufficiently lowered, the anti-inflammatory medication can be stopped, and just the allopurinol can be continued. It's nearly impossible to do an online search for gout without coming across a list of foods that you're supposed to avoid. Typically, these are foods like shellfish, fish, red meat, beer, and sugar-sweetened beverages. What you usually don't find, though, is a list of foods that you should be eating instead. For my patients with gout, I typically recommend either the DASH or Mediterranean diets. Although there are some differences between the two, both emphasize whole grains, fruits and vegetables, lean protein, and minimally processed whole foods. Both dietary patterns can modestly lower uric acid and come with other benefits like improved blood pressure or blood sugars. In terms of the list of bad foods, many of them, like beer, red meat, and sugar-sweetened beverages, not only raise uric acid and increase the risk of gout, but are generally not healthy anyway, so it's probably best to limit these. However, some of the other foods on this list, like fish or even some vegetables, are actually quite healthy and are prominently featured in the DASH or Mediterranean diets. In that case, I usually counsel my patients that it may be worthwhile to cut back on these foods temporarily, particularly if it's a clear trigger for your gout flares and you're flaring often. But once we get your gout under better control, for example by starting a medicine like allopurinol, chances are you'll be able to reincorporate these foods back into your diet without fearing that it is going to trigger a gout flare. Thank you so much for letting me speak with you about gout. I hope this short presentation gave you some food for thought and equipped you with some useful tidbits of information to actively participate in your gout care. Any further questions or concerns can certainly be addressed by your doctor at your next visit. Stay well.